Welcome to this brief introduction to the Postmaster Certificate in Nutrition and Integrative Health. This is an online program built for maximum flexibility for those participating. It is largely asynchronous, which means you get to do the work on your own time. However, there's plenty of opportunities for synchronous activity with your faculty and fellow students. The program takes about 1 year, and as with all of our programs, it is approved by the Maryland Higher Education Commission. Those 15 credits average out to 5 credits a trimester. We have 14-week trimesters, so that means this will be 42 weeks of work for the program. And on average, you're going to take about 15 hours of work per week in order to complete all of the activities related to the course, including watching videos, completing assignments, having synchronous interactions with faculty and students, etc. The primary audience for this program is healthcare and wellness professionals who are looking to incorporate nutrition into their practice, who can legally provide nutrition-based care, but who are not licensed nutritionists or dietitians and feel like they need to gain more knowledge and skills before beginning to apply nutrition within their practice. This may be someone such as a medical doctor, where nutrition actually falls under their license, or it may be people living in states where a certain level of nutrition practice is allowed without licensure. As a postmaster certificate, the minimum admissions requirement is a master's degree with a GPA of 2.5 or higher. You also need to have completed specific coursework in physiology and organic chemistry, 3 semester credits of both of those, and that can be completed at the undergraduate level. If you don't have this coursework requirement, you can be in touch with the admissions team to learn of ways to meet this. As a 15-credit postmaster certificate, this is a highly focused curriculum. We begin with a review of nutritional biochemistry, and then we progress to look at all of the macro and micronutrients, getting a better understanding of how carbohydrates, lipids, proteins, all the vitamins and minerals, the role those play in health and disease. We then move on to nutrition-based assessment, so understanding nutrition-focused physical exam and how signs and symptoms relate to nutritional deficiencies or excesses and toxicities. And then finally look at treatment planning. How do you prioritize needs for people? How do you support them with nutrition-based interventions such as dietary change and supplements? And finally, there's an opportunity to focus on a particular area of interest with electives. Some of the key electives include advanced coursework in laboratory assessment, as well as life cycle nutrition. As mentioned at the beginning of this presentation, the primary opportunity is for those of you who can legally do so to integrate some foundational nutrition-based care into your current practice. This program does also serve as a way to prepare for doctoral programs in nutrition. Specifically at our university, the Doctor of Clinical Nutrition program requires 12 graduate credits of nutrition for entry, along with other requirements. So if you meet those other requirements but need that graduate coursework in nutrition, this is an opportunity to gain it. So if this program seems like a good fit for you, I encourage you to submit an application. If you have more questions, you can come to an open house. Both information for application and open houses can be found on our university website. You can also contact the Office of Admissions if you have specific questions related to the admissions process, and you're always welcome to reach out to the nutrition department if you have questions about the curriculum. Thank you.